Good afternoon. Good afternoon. Good afternoon. Good afternoon, everybody. Good afternoon. Thank you very much. Thanks very much for jumping in this afternoon and joining. If you're watching later on, thanks for taking the time to catch up on today's update. It's going to be an exciting one for sure, and generates lots of questions, and looking forward to answering those questions this afternoon. But before we get into that, I just want to welcome everybody. Hi, thank you for being here. Good afternoon. Hi, Mrs. Elkin. Good afternoon, Elkin family. This is a great day for us. Not only is it a year to the day of the first identified case of COVID-19 in Westchester County, but it's been a year of working through the challenges associated with the pandemic. At the early outset last year, this time, we were just learning as much as we possibly could about the illness, and progressing through all of that information and all of those challenges, and ultimately focused on getting to a place together where we would be talking about welcoming our children back into school. And if you remember at this time last year, I was even still really hopeful that come the fall we would be in a normal situation. But of course, at that point in time, none of us knew. We just didn't know. I especially didn't know. So today really does mark a special day for us. I'm going to share a lot with you. I have some really outstanding questions that were sent in. Thanks to everybody who sent those questions in. If your question doesn't appear read as you wrote it, that's probably because it was combined with another question. But here's what I will say, because I've heard this. He takes the questions ahead of time so that he doesn't have to answer them all. I promise. I'm answering every question that gets sent, even if the answer to the question is I don't know or I'm not sure. So we have a bunch today. They're really great, and we'll go get right into those. And then, as a reminder, if we have time, I will go into the comment section and answer any follow-up questions that you might have. I'm happy to do it. Also, please remember, you can always reach out to us here in the office, or you can reach out to your child's building principal, who would be more than happy to help as well. All schools will be continuing question and answer and updates, obviously information sharing updates with our families throughout the course of the rest of the academic year, but particularly during this period of time when we're gearing up to start phasing our children back in. I know many of you participated in principal updates this week already, and I want to thank you for that. I want to thank all the principals, of course, as well, for continuing to be out there and sharing information and being an available resource. It's so important for all of our community members, so thanks everybody for that. I also want to thank our reopening committee. The reopening committee met this morning, went through and supported our plan for phasing our children back in 5 days a week, all children. So that is really exciting as well, and those folks have been really working hard for the better part of a year on the plans that we have in place to be able to support our children in school. And then before that, even, of course, building an education system from the ground up to be able to support children during a pandemic. So lots of thanks to go around. Very, very appreciative to everybody, and looking forward to answering our questions today. So I'm going to just jump right in there. Good afternoon, everybody. Thanks so much for being here. Hi, everyone. Wow, so great to have you all here. Thank you so much for being here and for sharing your time. Let's jump in. General questions. General questions. Well, actually, let's start at the beginning. Joe, what is the phase-in schedule? Yes. So we are going to be sending home, you don't have to write anything down, we're going to be sending home a letter either tomorrow or Friday outlining the weeks for the grade level phase-ins, and I'll talk about obviously all the mitigation strategies and everything that go along with that. But here are the weeks. The week of March 22nd, kindergarten, seniors, 12th grade, and 9th grade. Now, I'm fulfilling the promise that we put out there to get our youngest Tigers in and our most senior Tigers in first and foremost, but we also, with the help of our building level teams, added 9th grade to that week. So that's the week of March 22nd. Following the spring recess, which we'll talk about, the week of April 5th will be 1st grade, 2nd grade, 6th grade, 7th grade, all in that week. Then the following week, the week of April 12th, 3rd grade, 4th grade, 5th grade, 8th grade, 10th grade, and 11th grade. And the week of the 12th of April, all things being equal, all of our children will be welcomed back into our facilities, those whose parents and guardians wish for them to be in person. And I'll get into the particulars there, but that's amazing. And I know, believe me, I know that it's not soon enough for many folks, but when you recognize and you look at where we came from and where we are today and what needed to happen in order for us to get here, it really is quite a thing. And I am so thrilled, and I hope you are too. So, first question, with Easter break being the week after the spring semester begins, will it be an option for parents who are more comfortable to begin sending their children into school after Easter break? And there are a lot of questions like these, like when parents feel comfortable, and the answer is going to be the same. Absolutely, we want to work with you and support you. Please connect with your child's teacher and or the child's principal so that they know what's going on, how you're feeling, what the thought process is in your home, because every one of our homes is unique and every one of them is different. So if you have a question like that related to when your comfort level is going to be there, please definitely reach out to your child's principal. Questions related to the survey were the same. If I have to make a choice, am I stuck, Joe, with choosing full remote for the rest of the year or full in-person for the rest of the year? We're asking that you make the decision today based on how you believe you will feel the week of your child's grade level phasing in. So if you're not going to be ready to send your child in person that week, choose the full remote option. If a week after that or 2 weeks after that you feel more comfortable, again, reach out to your child's principal and talk about how you could take the steps then to start phasing your child back, or to bring your child back to school. School is going to be reopened. We are going back to 5 days of in-person instruction a week. That's the important thing to remember. So that's big news. But I also know that there's a lot that comes with that, a lot of anxiety and potential anxiety and concerns, and we'll talk those through. Between yesterday and today, there have been 8 reported COVID cases in the district. Is this fallout from the February break? Currently, with the hybrid option, parents could keep their children home after school breaks. If they're afraid, it's a similar question. If they're afraid fallout of the break, will they be able to keep their children home? We have cases of COVID-19 reported, unfortunately, almost every day. They have been going down. That's great news. They've been going down regionally. They've been going down in our community as well, which is fantastic. But yes, we still have cases, and we will continue to have cases all throughout the course of the remainder of the academic year. Again, though, to the question, if you're concerned for your particular child after the spring recess, please do reach out to us, let us know, and we'll work with you and walk you through it. Right now, we don't see any reason to think that necessarily we're going to see an uptick in cases. It could happen, but an uptick in cases following the spring recess. It's a little bit different in terms of spring recess this year and traveling and so on and so forth. During last reopening meeting, the Board of Education case rate or community spread was decreasing. Since then, the case rate is flatlined, but still relatively high. How will the return to in-person instruction be impacted if COVID stays the same, goes up, or decreases? So basically, how does phasing your children back in every day, how is that impacted by numbers going up, staying the same, or decreasing? Well, staying the same and decreasing is all great news. Going up, we will be watching case spread or community spread throughout our area and our region. We continue to meet with the County Department of Health and County Executive Latimer every week, at least once a week, and discuss those rates. We'll continue to monitor, and as more school districts in our region phase back in and there's more density in our schools, we're all going to have to be vigilant in our communities to make sure that we're not seeing a rise, particularly a rise at the school level, but even within our communities. And if we do see something that's increasing, we'll make adjustments if we need to get it under control. We've done that in the past. We know how to do it, and we can do it if we need to moving forward. But hopefully we don't. Parent surveys are due to inform the school if my child will be attending in person. It's hard to make a decision when it's been stated that some parts of the school day will change. like cafeteria, study halls, passing in between classes without detailing what the changes will be. Can you give us details to the school day changes that you know of? So basically what we're saying to parents is things may change. And we don't exactly know how they may change because it's really predicated on the number of students who come back in person. So it's like a chicken or the egg thing. We need to know if you plan on sending your child back, but you also need to know that there's potentially things that could change during the course of the school day. Not drastically, I don't foresee. But you know, cafeterias, for instance, increased distance between children, barriers, you know, high levels of health safety mitigations in our facilities. All those things are in place. I know the principals have been discussing that, and we'll continue to discuss that in the future as well. But it is important that you do make a selection and let us know. Again, even if you're hedging right now and saying, I'm going to stay full remote for the time being, do that and let us know. Know that we are planning for 100% return of our children. So your child's seat's going to be there, even if you plan for full remote. But we need to know so that as we're phasing in, we get a sense of how the flow of the day is going to go. Remember, you know, we've never done it. So this is another sort of novel thing that's happening. We're now phasing everybody back into school. And more to come will be there as well. For parents of fully remote students who were looking at the spring semester as a way to ease their kids into return to school under the hybrid method, or for parents who were only comfortable with the hybrid method, was it considered to allow continuation of hybrid? 3 choices instead of 2, full-time in-person, hybrid, and fully remote. We understand that it would be a lot to manage, and thank you for your question and your understanding. It would be a lot to manage. Essentially, our teachers, in many respects, are still depending upon the number of children who stay home on full remote, will still be in hybrid mode, delivering instruction to our children who are remote. However, we are reopening, right? So in terms of full reopening. So we do need to start having conversations about bringing children back in, as long as, from a health safety standpoint, it's amenable to the family. I would recommend, if you're having questions about health safety, that you do reach out to your child's healthcare provider, pediatrician, or another trusted healthcare provider to talk this through with them. You can share with them the mitigation strategies that we're following from CDC. I'm sure they're already aware. All of those things that are in place in our school district, and really have that frank conversation of, is it safe, according to your doctor, your child's doctor, for my child to return to school. I think that may be helpful to a lot of moms and dads who might be considering this. Why are we returning immediately to 5 days in person instead of 4, leaving Wednesday for cleaning and sanitizing? Well, thanks for the question. We clean every day, and we are planning on, in our schedule, which again, this will all be detailed in a communication that you receive from us this week, in our schedule, that Wednesday will remain a full day for children, a half day in person, right, that morning in person or synchronous, and then the second half of the day will be asynchronous. And that period of time will allow us to, number one, attend to the individual needs of our students, for faculty and staff members to connect with parents and guardians, for planning and cross-planning and intergrade level meetings and such that we've been doing all year. But it will also allow for our children to continue to utilize that time to catch up, to connect with teachers, guidance counselors, so on and so forth. And it does provide, again, some stability in terms of what they've been experiencing all year in terms of their schedule. So it's 5 days in person. That Wednesday, though, that half a day is asynchronous, at least for the near future. We can always and we will continue to explore as we move forward and as we get to hopefully 100% of the children all coming back who are able this academic year. Will there be routine COVID tests required for students? Is PCR rapid? Will there be testing done at schools? Are parents permitted to accompany their child to be tested? So we will have testing available. Again, folks have already indicated to us whether or not they are amenable to their child being randomly tested. That will be rolling out. We are testing students now, student athletes now. We're testing employees, staff members now as well, and that will be rolling out at each individual school. You'll get more information related to testing from your child's school, and if you have questions about things like, can I be there when my child's going to be tested, we can answer them for you at that time. The tests are the rapid tests, the By Next Now rapid tests. They're very, very non-invasive. There's actually a video of it available. You could watch it with your child, of me getting it done. It's really simple. And they will be available on a rolling basis all throughout the district, and that's part of the layered mitigation strategy. Again, rapid tests are better than nothing, but they're not PCR tests. They're not as accurate as a PCR test. Will all the schools be represented in the testing each week? Are there students represented in each grade level? Without enough student participation, weekly testing will be an ineffective layer of mitigation. Well, so again, this is not like that high-level scientific mitigation strategy where you're using for something like a PCR test. The rapids give you a good quick picture of whether or not someone should go get a PCR test, right? If they test positive for COVID-19, even if it could be a false positive test. Yes, schools will be represented on a rolling basis each week, and our health services department is ramping all that process up now. 6 feet of social distancing will likely not be possible in the lunchroom. By the way, 6 feet of social distancing is not possible in a lot of places throughout our school district when all children are in the building. And that's an important point. We'll come back to that, but it's an important point for you to know. How will that be worked out? Could you please provide more details on how lunch will be made safe now that the majority of students are expected back, since this is a period where children have no masks and are talking? There will be barriers in all the spaces where children will be eating. There will be distancing. We're spreading out lunch as much as we possibly can, reducing interaction between and among children as much as we possibly can. It is true, you do have to remove your mask to eat, and we recognize that. And really, again, balancing and trying to manage the risk associated with potential spread of COVID-19 or any communicable illness. So while we won't necessarily be 6 feet away from each other, there will be physical distance, there will be barriers. When children are not eating, they will be masked, and all of those protocols in place. But yeah, the lunch will be spread out and in different places depending upon the facility as well. If my children go back to school, but then I don't feel comfortable with the new process, can they return to remote learning? The answer is always yes, let's talk about it. We're going to need to address what the reason is why the children don't feel comfortable. It is going to be likely that COVID-19 will be with us in the fall as well. So we do need to do our very best to support your child, make sure your child does feel comfortable, or work toward building that level of comfort for your child so that we can get to a place where they understand that the steps that we're taking are going to help to keep them safe, and there's a lot of things that they can do to help keep themselves safe and their family safe as well. So we would want to talk to you about that, what's happening, and how, if at all, we could support you, because we do want all of our children to take advantage of coming back to in-person learning as soon as it's available to them. Will fully remote option still be available in September? Thank you for this question. It's really important that everybody understands that everything we've been doing throughout the pandemic is governed underneath an executive order. There is no pathway to remote learning or hybrid learning in the state of New York through the New York State Education Department, pre-pandemic, right? So right now, the ability to deliver the instruction the way we're doing it is governed under the executive order that keeps getting extended. I don't think, I certainly hope not, that there's going to be a health reason or a health safety reason come the fall for remote learning to still be in place. So if I'm a parent or a guardian thinking about the fall, I would be thinking that school is going to be in person for all children. That's not to say we're still probably going to be wearing masks and barriers and all those things, but school will be in person. And that's important to start thinking about and having discussions, if you haven't already, with your children now. Thanks for the question. What if parents can't choose either option? Is hybrid still available? Hybrid will not be available. Moving forward, children will either be in person or they will be fully remote, and we can work with you on trying to get you comfortable in person, or certainly, of course, to support you in remote. But hybrid is going to be phased out as we transition back in person full time. How would I know if it's safe for my child? More kids in school, on school grounds is more risky. Again, great question. I would encourage anyone to ask that question to your child's pediatrician or healthcare provider. We are following all of the guidelines and then some, trying to increase the layered mitigation strategies that we have. We're going to keep increasing them throughout the spring and the fourth marking period, all the way to the end of the academic year. But that's a great question for your child's doctor, because they know your child's healthcare situation, or your home healthcare situation. There is risk, right? There's always risk of getting sick in a public space, COVID-19 or anything. But what we're doing is we're trying to reduce that risk to the greatest extent that we're able. Are all staff members fully vaccinated? If yes, how would we know that? Thank you for your question. This is a great question. I'm glad you asked it, because somebody said to me, well, how did we get to where we are right now? We're talking about fully phasing our children back in. What happened? And I'll tell you what happened. I'm really thrilled to be able to tell you what happened. And thanks to the partnership of the WPTA and NICET and CSEA and ASA, all those acronyms of our professional associations, and most importantly, the Westchester County Government and the Westchester County Department of Health, the White Plains City School District last Friday we hit 100% of the vaccine opportunities needed for folks who expressed need in our district. So what does that mean in English, Joe? Everybody who told us they needed a shot, through our partnership with the Westchester County Department of Health, we were able to offer, and our professional organizations, we were able to offer appointments and opportunities for vaccine. So we're in really strong position right now with regard to vaccine, and you'll recall that was the sort of foundational underpinning on which we were going to build our full reopening. So we're really thrilled about that. That's amazing. It's amazing and other school districts in Westchester County, this is happening as well. It's going to continue to happen, and this is good for everybody. You probably heard last night that the Biden administration announced that the country is now going to target education professionals as primary folks to get vaccinated. That's great news for the country. It's great news for America's children. It's great news for schools. And I believe the target for that was as early as the end of the month, as in March. So that's fantastic, and we're certainly supportive of that. You won't necessarily know if your child's teacher or support staff members are vaccinated unless they tell you. We will have percentages that we will share with the County Department of Health, and then I know that those percentages will be shared publicly as well. But I will tell you that in my interactions anecdotally, everybody that I've bumped into who has had the opportunity to get vaccinated in our school district is taking that opportunity if they're able. So that's good news. It's great news for our faculty and staff members as well. There's no air circulation for COVID-19 variant exposure in buildings. How will the district monitor COVID-19 variant symptoms between staff and students? So we're talking about the mutation, right? The variant of COVID-19 that's out there and still being studied. We are approaching that or those the same way we were approaching the original strain of COVID-19, and we're trying to reduce spread. So with regard to HVAC and ventilation in our facilities, we're very fortunate. As you remember, way back in spring and summer, we went through all of our facilities. We made upgrades to our HVAC where we needed to. At the end of the day is that we have unit ventilators in our classrooms that are bringing in fresh air and taking out the air in the classroom regularly. And that's what you want. We're also going to introduce additional air purification products into the classrooms throughout the course of the spring. That'll be a mitigation layer on top of what we already have, so that's above and beyond. And this is a great one, we're going to be able to open the windows. And folks are encouraged to keep the windows open if they're able to tolerate pollen and such to increase that air circulation as well. Next week, I think we're going to have a few days close to 60 degrees. I would imagine windows and doors will be open as well, increasing air circulation. Will there still be half days on Wednesdays? So I talked about this a little bit. We still have the Wednesday schedule in person and synchronous in the morning, and then fully asynchronous for children in the afternoon. So yes. What provisions will be made for those students who will, by choice or by necessity, continue to learn fully remotely? Will the same model of synchronized classroom instruction? We want to be able to keep the same experience that children have had all throughout the course of the year. That's important to us. Our teachers have been working very, very hard to be able to support their kids. We want to keep doing that, moving all the way through the remainder of the year, even for children who are remote. That's why we're collecting the data, so that we know what we're looking at in each of our classrooms, and so that our faculty and staff members have a sense of what each class will look like for them based on the number of children who will be in person or who will stay remote. Is the district considering assigning some teachers to focus only on students that are remote? No, we are not at this time. And I know that was something that folks were talking about. We were very intentional in setting up classes so that our children would be in classes with their classmates and with their teacher. We do not want to break that up and create essentially two school systems. We want to keep our kids in their classes. What will remote instruction look like once the phase-in starts? It will continue to look like it looks now. I mean, could there be changes based on the number of kids who are remote or in person? Sure, but they'll be discussed at the classroom level, and we're happy to support and continue to support our faculty and staff members and our parents and guardians and kids in any way we can as the phasing happens and as we move into this next stage. Why can't we end the year in the hybrid model? With the new COVID variants reported in New York City, going full person is bold and worrisome. Also, why are we opening schools right after spring break? Many people are traveling for the break. It's very scary. Thank you for your question. We are doing exactly what we plan to do. There's nothing, really out of the line of thinking and planning that our reopening committee has been engaged in over the course of the entire year. We actually got to it a little earlier than we anticipated, and that was by the good providence of being able to access the vaccine we needed. But in terms of managing risk, we're going to be very conservative, like we've been in managing risk. But at the same time, we also know that it is possible and it is safe now for us to be able to come to school full time. People's levels of comfort with that are going to vary. So we want to be able to support our families who choose full remote. And we'll absolutely do that. But we believe that it is very important to get children back into the classrooms this academic year, start working on some of the concerns related to maybe anxiety or disengagement or just falling out of the routine of school, handle them now so that September is a much more typical school reopening for our kids. We think that's important. We're ready to support parents and guardians and students who may need additional support in phasing back in because it's been a long time. It's been a year. And we know that people are at different levels with their comfort related to that. Thanks for the question. I watched the reopening committee session from last week in February. I'm not satisfied with your response to the guidelines set by CDC and highlighted by John LaPlaca. CD guidelines clearly state that schools should prioritize 2 mitigation strategies. 1, proper mask wearing, and 2, social distancing, and then the writer puts in parentheses 6 feet apart. Since many of the schools cannot accommodate the second mitigation strategy, how can you safely allow students to return in-person learning when you cannot properly adhere to the 2 priority mitigation strategies? Thank you for your question, and this is important. You must read the guidance carefully. It's 6 feet, right? Or anything below 6 feet and a mask, but not closer than 3 feet. So there is a sliding scale and a continuum in CDC guidance that school districts can follow with the proper layered mitigation strategies. So to the questioner, how is it safe to then do this to go below 6 feet? Because we have the mitigation strategies in place. We would not be bringing children back into the facilities if we did not believe we have achieved the level of safety and security for their health and for our community's health that is necessary. We just wouldn't do it. If, in fact, we find that when we return more children into school full-time, it causes an issue related to case rates and community spread, we'll pull it back. But to your point, we are following CDC guidelines, and we are following New York State Department of Health guidelines, and we will always do that. We will stay in bounds there. But 6 feet everywhere is not practicable. It's just not something that we would be able to adhere to in a school setting, as you know. Will there be remote access to school for those who have to quarantine? Yes, absolutely. The remote program and platform will stay available if in fact we need to contact trace and quarantine and isolate, which is definitely something that will probably occur. Definitely, probably. I would think that we're still going to experience situations where we have to contact trace and where we have to quarantine and isolate, and remote learning will be available to our children during that period of time to try to reduce the number of disruptions that they would be experiencing. Well, with social distancing in classrooms reduced to 3 feet in a barrier, what are the new guidelines for quarantining when a positive case is identified within a school? There are new guidelines related to quarantine. The contact tracing process is conducted with the County Department of Health. We will continue to follow all of those guidelines. We will have assigned seats, and of course, we'll have as much distance between and among children as possible in the classroom setting, and hopefully that will help to mitigate the numbers of students who might potentially be caught up in a contact trace. There is something you can do about that, though. If somebody at home isn't feeling well, or if a child expresses that he or she they're not feeling well, keep them home. They can engage in remote learning, reach out to the nurse and the teacher, but keep them home. Even if it's just, maybe it's just a cold, keep them home. Because just a cold might not be just a cold, it might be COVID-19, and that could end up really setting us back in terms of our ability to remain open 5 days for all kids. So please remember to keep following those great best practices that you've been following all year long. Okay, I'm so sorry, I almost skipped one. How are we supporting members of our school community who cannot be vaccinated when we start our phased-in return to in-person instruction? So I'm not sure if maybe this is a question related to employees, but I'll do it in generalities. So anybody who's in the school community who cannot be vaccinated or chooses not to be vaccinated should definitely reach out to their direct supervisor or the Human Resources Department if you have any particular health safety concerns. You should definitely reach out to your healthcare provider if you haven't already done so and talk to them about what your concerns are. We will be happy to provide any type of mitigation that we can, any type of support services that we can for you to be able to be safe and protected in your classroom or in your area. For those outside in our community, how do we protect people who are not vaccinated? We do that with your help, parents and guardians, making sure that we're being careful and safe outside of school so that we're not potentially spreading COVID-19 or any illness throughout our community. With an increased population density, there is a risk of viral spread. To avoid extensive disruptions to our schedules due to quarantines, how are we ensuring that every individual fills out health screeners, like I just spoke about, and continuing to remind folks to please take that responsibility very seriously. That will help us stay where we want to be, 5 days in person. Why is hybrid no longer an option? It would allow for fewer disruptions to students doing well in the current setup, and since teachers teach to remote kids, would be no more taxing. It's very taxing to really have those 3 different scenarios in a classroom, despite the fact that our faculty and staff members have been doing tremendous. We're moving away from hybrid because we're coming back to school, and I'm excited to be able to say that. So we're transitioning away from hybrid because we are welcoming all of our children back to school. Not going to be okay for everybody. I understand that. We respect that. But we are transitioning back to full day, full in-person 5 days a week. And eventually, full day, 5 days in person. Other than the current survey and this live, lost you for a second. Other than this current survey and this live, how was the decision to transition to full in-person learning conveyed to school community to support best accommodations for all families? How were opinions gathered to make this cohesive decision? Appreciate the question. Lots of stakeholder input in everything we do, from the school level to the district-wide reopening committee level to each and every one of your individual emails or telephone calls or ways in which you've expressed your thoughts. So we take it feedback from everywhere we get it. The most important factor, of course, is how can we best serve our children, and how can we safely return them to the educational setting that they will be successful in. If parents with kids in the hybrid program decide full person option within this proposal, decide against, the child loses any in-person interaction with peers and or teachers. The lack of options available to allow for continuation of the hybrid option to finish the school year is not currently clearly relevant. The haste to transition before the spring break is unnecessary and premature. Please advise on the lack of options and the current timing. Thanks very much for your question. Appreciate your viewpoint there. Certainly you're not alone. The timing is, I've explained that, and also the rationale is that it's time for our children to be able to return to school. And again, all extenuating circumstances understood, and certainly, unforeseen things understood. That's the direction that we're moving right now. If a student is fully in person and must be absent for illness or quarantine or etc., will he or she have access to online Zoom lessons? Yes, absolutely. And questions like that, again, great questions, and I know the principals were touching on those as well. What metrics will the district use to determine the necessity to move back to a hybrid model? Will it follow CDC guidelines at the level of substantial transmission, which would be greater than 50 new cases per 100,000 daily, or schools should be in a hybrid mode? We follow the New York State Department of Health guidelines. So CDC has a couple of different models they have out there. One of the models, the one to which you refer, if you look at the map, almost nobody in the country would be able to move out of hybrid, because the 50 per 100,000 is a very low bar. But at the same time, it's important that we're watching. So we're utilizing New York State Department of Health and Westchester County Department of Health. Work collaboratively with them and make decisions based on community health with them as well. I hope that answers your question. While the installation of barriers seems like a good option, the medical community has cautioned that plastic barriers, including register shields and makeshift outdoor dining panels, are trapping potential virus particles in an enclosed space. Commercial air exchange filters would be more effective in circulating airflow in the case of transmission. What are your thoughts? Thanks for your question. I agree. Absent, and that was that New York Times infographic animation that you saw, absent the appropriate HVAC in a room, barriers alone are not going to be the answer to necessarily reducing spread of any contagious illness. So you need that layered mitigation. The barriers to which folks are referring that potentially impede airflow are the ones that are all throughout a room that are from the floor up. The ones on the desks, remember, you're a human sitting there too, so everything in the room impedes airflow in some form or fashion. The barrier, along with masks or even double masks and face shields, is just another layer of potential, a stopping power from the spread of the virus. The good news that we've learned is that virus transmission from surfaces is very low, if at all, a concern. So, as long as you're not putting your hands in your mouth, right, touching something, putting your hands in your mouth. So it's about keeping the transmission from the respiratory system out into circulation for other folks to pick up. Thank you for your question. Please provide reference to the CDC guideline or language that supports the obviation of 6-foot physical distancing for physical barriers. Yes, certainly. First, you can reach out. You can see the sliding scale, the New York State Department of Health guidelines, which you can access on our district website or from the New York State Department of Health website. CDC guidelines is a little bit more clear. I will direct you to classroom setups in the latest guidance that's been shared, and we'll put a link in the comment section. You will go to page 5 in the classroom setup, and it is map C. And you will see in the CDC guidelines what a classroom looks like that doesn't have 6-foot distance, and how you would layer the mitigation like we are doing here in White Plains to be able to achieve that. Thank you for your question. These questions are school specific, so they came from parents and guardians in specific schools, and I'm going to start off, no, not order of importance, just the way they were given to me. This is White Plains High School. Assuming students are able to resume students who are coming in full in person, what are the chances of full in-person graduation for seniors? We're planning full in-person graduation for seniors. So good chances. When do you think that White Plains High School could resume 5-day instruction? We've gone through that. The seniors will be starting, seniors and 9th graders will be starting the week of 22nd. Will teachers still be doing remote and in-person simultaneously, or they'll be dedicated to remote teachers? Presently, teachers will still be attending to children who are in full remote. We're anticipating most of our children will be returning in person. Will there be a new protocol if students are exposed to COVID? Protocols are exactly the same for potential exposure and contact tracing. They've been updated, and we will continue following that guidance. There's a question here also, would this apply to teachers as well? I understand that if you're fully vaccinated and exposed, that quarantine period is different. It can be, based on CDC guidelines for a period of time. New York State Department of Health has not yet adopted that, though. So remember, we follow the state, and we have to do what the state says, but we understand that it is likely that folks who have been vaccinated will have a different experience in that type of a setting, which makes sense, right? In terms of having to quarantine or isolate. But there'll be more to come on that. Okay, 1A. How will the proper full nose and mouth covering mask policy be enforced? Our child has a rare disease where contacting COVID would put them into a high-risk, severe negative outcome, which is in contrast to conventional thought that kids do not get sick. Okay, so thank you for your question. A question basically is, how are you going to make sure that kids are going to keep their masks on, or adults are going to keep their masks on, wash their hands, so on and so forth. First part of this question in 1A, I would say definitely have a deep conversation with your healthcare provider about whether or not this is a step you should take with a child who potentially has a rare illness that could be very problematic if the child gets sick. With regard to enforcing mask wearing and best practices and distancing, yes, we will absolutely be doing that, just like we do with children, and tying their shoes or keeping their hands out of their nose, or all the other innumerable things that children do in the classroom or in the hallways on a daily basis. And we will continue to reinforce that, and that's an expectation, and it's a requirement to be able to participate in person learning. So we ask for your support there too, moms and dads, and we will also do that with our kids. But I do want to say to our Tigers that are watching, I know you know what to do, and with your help, we will be able to continue to offer you more and more and more. But we have to follow these health safety guidelines. It's really important. So that means mask over the nose, not under the nose, right? All of those important things. 1B, will hallways be monitored during the transition between classes? It was clearly stated in the fall that teachers would not monitor as it was not safe for them to do so. Other schools that have fully I always love that one. Other schools that have fully reopened have instituted a zero tolerance policy for not wearing masks properly. This means that there is one reminder to properly wear a mask. After that, they are removed from school for the day. Parent comes to pick them up. Yeah, we're not going down that road at all. We'll talk with our children and remind them and educate them and support them. But we're going to take definitely the positive route to this. It's not going to be punitive. If a child is blatantly not, flouting the rules, it's a different conversation. But we're not approaching this from sort of a negative outlook. It'll be from a positive outlook. Will Wednesday become a full day of school with all classes at a standard length? We talked about this. Wednesday is going to remain that same schedule, half in person, half asynchronous. Will choice from the survey be locked for the balance of the year? No. You have flexibility, but we do ask that you make a selection now so that we can plan appropriately for at least the initial phasing. If you decide later on, it's time for my child to come back in person, we'll be able to support and accommodate that. But please make a choice. Why is there not an option to have study hall and or lunch outdoors, socially distanced? Considering our child's medical issues, the safest place to eat outdoors. Like many students, he brings his lunch to avoid being in the cafeteria. There will be an option, absolutely, to eat outdoors. We'll have spaces available, and as the weather gets nicer, more and more of that as well. So thanks for that question. Great idea, and definitely one that we should be looking to take advantage of all the time. It seems like every teacher is doing a different teaching model. What will virtual learning look like? I would say in this question, and thank you for your question, it seems specific probably to your experience and your child's teachers. I would definitely reach out to the child's principal and or the teachers to talk about that particular experience. The overarching virtual learning experience will remain constant moving forward into the rest of the year. How will the high school students take exams in June? Will it depend if a student chooses all virtual or all in school? It just seems as if this is the case that students who are taking exams at home would have an advantage with more resources available to them home. So honestly, we're still waiting to hear from the New York State Education Department on how regents will roll out and when they'll roll out. We do know that they're going to be very different this year, not necessarily linked to graduation, so on and so forth. But in terms of regular in-school exams, that's definitely a good question that you'd like to share with your child's teacher prior to the examination period coming up. There are a number of ways that we can make sure that we're administering a proper assessment, even remotely, and making sure that it's done in an equitable way. But thanks for the question. Why the sudden push for 5 days of in-person now? What's changed? The volume of children is too large to safely have anyone in the high school and the middle school at the same time. Families need the opportunity to be vaccinated before kids are exposed. If we are rushing forward, remote instruction cannot be compromised for those who cannot attend. We're not rushing. Thanks for the question. Appreciate it. Normal response, I think, to big decisions, right? But we are absolutely not rushing at all. We are doing exactly what we've done. Thoughtful, collaborative planning that's based on achieving goals for health safety. And that's why we are where we are right now. It's not a rush. It's where we want to be, and we're happy about that. But it's because we've been able to achieve the level of success in the other areas of mitigation that we are where we are right now. But thank you, I absolutely appreciate that. There are a number of families marked as hybrid today that are not attending. I would assume that the same will happen with survey. How will be accounting? Assuming this is maybe a question from a teacher, I'm not understanding the question. I'm thinking you're asking about taking attendance. That's definitely something we'll have to address on a daily basis. For instance, maybe you're asking if somebody's scheduled to be there in person, but they show up remotely that day, should I mark them absent? No, I would think we're going to mark them present and then find out what's going on, why they're not in when they should be in person. I hope I hit that right. What is the percentage of kids that came back for additional days offered at middle school and high school? Lots. I don't know what the exact percentage is off the top of my head, but I can tell you we have been increasing opportunity for children to attend more often, regularly throughout the academic year. I don't understand how we will go from 1 day a week to 5 safely so our kids and teachers are socially distanced. My son is currently once a week. He would like to go twice a week, but not 5 days a week and not 100% remote. Wouldn't it be better to add a day or 2 days at a time? He said lunchtime people are currently not 6 feet apart. Yeah, that's definitely true, and thanks for the question. Listen, I understand there are probably thousands of different variations that we could look at in terms of a phase-in. Why? Because every one of our families' thoughts, needs, reflections are all unique. And we've said this all year long. That's why we are taking the approach that we've talked about taking all year long, and phasing the children back in now fully. And again, you have the option for remote. If you have a concern about being in 5 days a week, I would definitely suggest reaching out to the principal, child's teacher, and we'll support you in the best way that we can. But we are now moving to full 5 days in person. The communication for the high school parent survey stated is currently a closed campus. Will this be for the remainder of the school year, allowing kids outside of the building on nice weather days, study hall, lunch, and other things will improve social distancing? You'll hear more about that from Mr. Martinez and our team at the high school, but yes, we're going to be taking advantage of outdoors as the weather gets nicer. We agree. Absolutely. Vaccination of the teachers and school staff have been a major focus in the return to in-person instruction, and they are a valued part of our community. Thank you for that. Low community spread is critical to successful return in person. Will the district support and advise community and parents to get vaccinated when vaccines are available for them? Yeah, absolutely, you bet. Will the district offer to become a vaccination distribution site? We've done that. We are on the list of being a distribution site for the general health community. Okay, so this is another question. Do I think 16-year-old or older White Plains High School students should be vaccinated when the Pfizer vaccine is available to them? Will the district support vaccinating them similar to how the district supported vaccinating teachers? Parents and guardians will decide. Thanks for the question. Parents and guardians will decide what's best for their children related to vaccines. Adults decided what was best for them related to their health safety as it comes to vaccines. I will not personally weigh in on what moms and dads should do from a medical standpoint with their children. However, I will say that it is strongly suggested that parents have this conversation with their doctors, and based on how they feel that way, make a decision when the time comes. But yes, the school district will continue to communicate available opportunities for for community members for vaccination, and we are also on the list as a potential distribution site if need be, or if the opportunity presents itself. Thank you. Moving to middle school. Will there be a tour for remote students, especially since they've been out of school for a year now, and Eastview being completely new and a big school for them? Yeah, absolutely, and there actually are virtual tours available, and I know Dr. Rodriguez and the team at Eastview are working on all of that right now. Thanks for that question, it's a great question. At the Eastview meeting yesterday, we were informed that classes won't be disinfected during school hours due to the 3 minutes in between classes. 3 minutes is enough time for teachers to wipe down the desk. Kids can't bring in Lysol wipes to wipe down their desk. Pardon me. The response was no due to health, meaning allergies and others. Why can't the teacher take the 3 minutes to wipe down the desk and chairs for the next class? The students will be in a different desk 9 times throughout the day, and can students bring wipes to school to wipe their own area down before they sit? So let me take the last question first. There are wipes that can be used on desks that moms and dads can send in with their children that are not in violation of the Lysol wipes. You're not supposed to carry Lysol wipes and such. You'll remember before the pandemic, you weren't even, by state law, weren't allowed to have hand sanitizer on school buses. So, can kids wipe down their own desks if they desire? Yeah, sure they could. Will teachers be wiping down desks in between classes? Probably not. Again, COVID-19, other illnesses you could pick up as well, but COVID-19 doesn't really transfer well off of solid surfaces, so making sure that we're washing our hands, not putting our hands in our faces and our mouths and the like, is really important. But teachers will not be disinfecting desks regularly throughout the course of the day, but absolutely, students can wipe down their desks if they so choose, particularly our older students. But we clean the facilities every day, so that's really important too. So overnight and then throughout the course of the day, the facilities are constantly being cleaned. When can we plan on sending our kids with more, quote, mask freedom? If teachers are vaccinated, the transmission from student to teacher is extremely rare. I don't know if that's necessarily the case. I'm not sure about that, the science there. When can our kids resume a normal life? Our kids want to play together and interact and make friends. I want them to gain social skills and not become numb to mask wearing, even if it's just not wearing masks within the classroom or at least when they are outside. Thank you for your question. Certainly understand your feelings. At this time, all children and all adults will be wearing masks at all times in our facilities until further notice. So that's not a thing for school. If that's something that you're looking at home, certainly understand that, respect your position. But children will be wearing masks at all times unless they're eating or unless for health safety reason they can't in our facilities for the near future, for sure. Can you please explain the thought process around staggering the return of elementary students? The announced phase-in model will make it very difficult for families with children in multiple schools to organize themselves in the morning for drop-off and in the afternoon for pickup. Yeah, sorry about that. I understand that. Really, the phasing is based on what our teams have deemed to be the best approach for us bringing our children back into school. It's over the course of 3 weeks. So realistically, hopefully, the disruption to your family is significantly reduced at the close of that 3rd week, meaning that your children, if you so choose, are in school 5 days each week. As we phase students, will all students that are as we phase in the students, will the students that remain fully remote still have the same teacher? Yes. When will 3rd grade phase in? I think we went through that, but you'll also get the schedule. It'll come home. When we receive the targeted return dates, when will we receive the targeted return dates? Either tomorrow, well, you have them. I mean, they're available today, but either tomorrow or Friday, you're going to get that K-12 alert, and there'll be more coming as we near those weeks, and certainly from the schools and the grade levels reminding you which grade levels are phasing in which week. I think it's great that students are going back to school full-time, especially K-2. The only conflict is that after-school care and working parents. My daughter was offered to come back in February. Unfortunately, I had to decline due to the lack of limited space in the after-school program. So I'm sorry about that. Hopefully we will be able to help increase the number of after-school activities as we go forward, but there are some things, unfortunately, right now that are just out of our purview, and aftercare is one of those instances. What is the expected time frame to have the barriers installed? They're being installed right now. The expected time frame is that for each grade level that's phasing in on their particular week, that barriers will be in place for those phases. I am aware that additional lunch staff has to be procured. I'm not sure about that, and that's not a question, so it's just a statement. Does that impact kindergarten? Is kindergarten going to continue to eat lunch in the classroom, or will they move to the cafeteria? If one school is ready to receive more children but others aren't yet, does the school have to wait for the others to be ready? All of our schools will be ready at the same time based on the weeks that the children are be phasing. Lunch is going to be different in different places and different facilities. That'll be talked about at the school level. We will have barriers for cafeterias, and we will have barriers for shared spaces as well in all of our facilities. The principal of I'm in elementary school questions, by the way, right now. The principal of Ridgeway has confirmed that all students won't be able to be at a 6-foot distancing and that barriers will be installed. She also said that they keep the windows open. Can you tell the schools to please have the windows open in the cafeteria all the time? We will have the windows open, absolutely. Seems like an important part of the layered mitigation. Yep, we agree. We agree. What's happening with Wednesday? I think we went through Wednesday. Have the air handling systems in the school, specifically in the cafeteria, been upgraded since this is where kids will be eating without masks? Yeah, so I talked about this earlier, all of our HVAC systems have been reviewed and upgraded as needed and maintained as needed. And then we're going to have windows, and we're going to have density reduction in the spaces when we can. And then we're also going to have additional air purification introduced into all the environments too. Will elementary schools have tents for outdoor classrooms along with middle school and high school? Yes, we will. If elementary students will be returning to specials classrooms and possibly sharing outdoor tents, that's a big possibly. That would be something that will be discussed at the school level. Will the classrooms be cleaned in between classes? Middle school and high school can and do clean their desks as they move through the buildings. But elementary will elementary be expected to? Again, that's something that we could discuss at the school level. I think desks should be cleaned when they need to be cleaned for sure. But again, also at the elementary level, you're going to be sitting in the same desk for the majority, if not the entire day, with the same person in the same desk. How will tents be placed in the open areas in the school to allow for effective and efficient use without taking away limited outdoor space or recess and other necessary outdoor activities, including, it's always like, right, there's the one good thing, and then on the other side there's the negative. Yes, so if we put a tent up, the tent has to take up some space, absolutely. So we will put them in areas that hopefully will not interfere with play on the fields. Like, we're not going to drop a tent right in the middle of the field, right? Put it off to the side, a place that's more conducive to take as much advantage of the terrain as possible. Thank you for your question. Data indicates that individuals of color are reluctant from taking the vaccine. What is the vaccination rate and data for our Ridgeway school teachers and staff? This question was unable to be answered by the principal during our family Zoom. I was advised that the information was a HIPAA law and could not be disclosed. I'm assuming that she'd understand the question. We don't need to know who is vaccinated. We like to know the data specific to Ridgeway following a notation on the January 24th reopening committee meeting. You stated that approximately 260 shots or 70% were given to school personnel. So based on that information, what percentage was Ridgeway specific? I don't know what percentage was Ridgeway specific off the top of my head. I do know that we've achieved 100% with regard to all the folks who indicated that they needed to get a shot. I also know that the percentages related to school districts and schools are being collected right now and will be available for public. I still don't really know how that changes the calculus of a decision-making process, though. I understand that it's nice to know things, but I wouldn't hold up decision-making based on getting percentage data from individual schools or school districts. I think that will come. You'll definitely have it because we'll want to show that school districts, by and large, I think will probably be very, very high in the number of individuals who choose to get vaccinated, as opposed to some other professional areas that have been highlighted as being of concern. So more to come on that. I don't have that answer right off the top of my head for you. I'm sorry. Parents feel we are being obligated to choose full-time remote or full-time in person. If we select one or the other, are the children able to make changes if we need to? Yes. What's the phasing schedule for, the phasing schedule again will be shared. There is currently no plan for in-person band or orchestra at the elementary level. How will students, especially fifth graders, continue with their instrumental learning? Yeah, we're still going to have to work that out. So there'll be more to come on instrumental opportunities at the elementary level. What specifically will change for fully remote students? How will their school day be modified? Less or zero Zooms. We're going to try and make sure that we're going to try and keep everything as close to status quo as possible. Once we begin the process, we will know better if we have to make any tinkering or changes, but all of that will be communicated. And definitely it will not be zero interaction, and definitely it will not be siphoned off into a remote class or something of that nature. Hopefully that's helpful. Specifically for kindergartners who have been fully remote and are looking to return to school, we assume parents will not be allowed to walk their kids into the classrooms on the first day. So yeah, no, and typically parents never walk their children to the first class to their classroom on the first day either, just so you know. And they aren't gathering in the auditorium, right? Will teacher assistants be waiting for them to pick them up? Can big brothers and sisters walk into the classroom? Will it be a virtual walkthrough? So basically, will we be taking all of the necessary and appropriate steps to make sure we're supporting our youngest tigers when they're returning back or coming back to school for the first time? Yeah, all of that, absolutely. So important for, a kindness to be shown everywhere for our children, and a lot of understanding that this is almost like, in many ways it is, the first day of school for them. So we're going to have to go through routines, and we're going to have to go through expectations and norms and all of those things, and we know that. And we'll do everything we can to make that transition as seamless as possible for you. Thank you for your question. Will specials continue with 3-week rotations, or will it default back to A to F days? That's a question I think we're going to have to, I'll defer that to the principals. Will the amount of screen time be reduced for in-person learners? I understand the value of ed tech, but there's a lot of time. We're going to do everything we can to, obviously moderate the use of devices in person learning. We use devices regularly, even pre-pandemic, but with a recognition that children have been on devices a great deal. I know that our teachers are going to be doing what they can to get them away from devices whenever possible, including getting outside, right? Why is AIS support still going to be virtual? This is a question I would like to, if you don't mind, we can talk about this offline. I think it's very student specific. I want to get too student specific. Okay, last question, and then I will go into the comment section. Is it possible to extend the deadline to provide more definitive information concerning full remote and fully in-person learning? Hopefully this helped today. Hopefully reopening committee helped today. You're going to, like as I mentioned, you get continued updates from us. If you didn't fill out your survey today, can you still send it in tomorrow? Yeah, absolutely you can. We had a meeting Monday night. Mr. J at MAS talked about plans to open. Thank you, Liza. Thank you, Mrs. Torres, giving me the new questions. Parents cannot make an informed decision with so many unknowns that could affect the health safety of their children. Again, hopefully we're covering some of those right now, or maybe even covered some of those in reopening committee meeting, but I know the principals will continue to communicate it as well. We understand district needs time to implement the new safety equipment. Thank you very, very much for your questions. Okay, so these are the questions. I think Mrs. Torres just pulled them out of the comments for me. Here we go. If you are full remote, do you go in person for Regents examinations? So it's a great question. We're still awaiting the guidance from the New York State Education Department on how and when Regents are going to be administered this year. And we'll get back to you specifically on that and how children who are fully remote will be taking them. With New York State Regents in early June, basically high school students would be going back for 8 weeks, right? I think it's closer to 10 weeks. I'm not sure, but maybe close, 8-10 weeks. But Regents is going to be a little bit different, I think, this year too. So it's hard. I would think closer to 10 weeks. If we wind up as a district staying remote for any reason, is there a plan to start utilizing Wednesdays for full day instruction? So I don't anticipate that we will be fully closed or staying fully remote as a district at all. But certainly there is a plan to phase out Wednesdays as a half-day asynchronous when we have all of our children back or in one spot. Right, so teachers are not diverting their attention to 2 and or 3 different modalities of instruction. That is absolutely the plan. Is the Wednesday afternoon asynchronous in school, or are they getting picked up and doing their work from home? It would be from home. So the children will be, coming in the morning, and then they'll be going home. How do we mitigate the risk from higher density on school buses that are going to be assigned seats to limit potentially daily exposure? We do have assigned seats in the buses. There will continue to be assigned seats in the buses. Children should be sitting in the same seats. That will help with potential contact tracing efforts should it arise. We're also trying to keep as much distance as possible on the buses, but we do recognize that it's going to be below 6 feet. Masks are required, absolutely required. Double masks, some folks are wearing double masks. Parents and guardians are thinking about and can certainly and are welcome to bring their children to and from school as well if that's an option. Always thinking about mitigating risk, right? So reducing the amount of risk that you're going to experience in a day. Many families look at the day and try to reduce where they can individually, but buses will continue to be run. Will the COVID vaccine be mandatory for children? I have no idea. That is outside of my bailiwick. And if something like that were to occur, vaccinations that are mandated by law, they come from the state level, not from the school district level. How do we mitigate the risk for higher, I'm sorry, I already got that one. Comment, teachers should wear some sort of badge indicating that they received the vaccine just like they do to hospital workers. That's a personal choice. I have a little sticker on my badge that says I'm vaccinated. I'm sure other members of our community do as well. However, we're not sort of setting up a system necessarily where folks are going to be displaying their personal health care information. But again, many folks, I think, have no problem telling you that they've been vaccinated, but that's definitely a personal choice. Thank you for your point. How do students who are fully remote take the language arts states exams that are slated for the middle of April? There'll be more information on that. We've not gotten that information yet from the New York State Education Department. Will the teachers be given a day or two to prepare? As a teacher, I recognize it'll be a huge transition and they need time to physically prepare. So teachers are and have been and will continue to be supported in whatever they need to do to prepare. But again, this is a phased process, so there is time. It's not something that's happening tomorrow. It's a thoughtful process that will be implemented over the course of 3 weeks. That is still yet 3 weeks away. It's a lot of time, and there's not a whole lot of new things that outside of the facility changes, the mitigation strategies that hopefully will have to happen in the classroom for teachers. Hopefully. Thank you for your question. In regard to travel quarantines, the daily check in states 14 days, in New York State guidelines 10 days. What should family follow? Family should follow New York State guidelines for travel and quarantine. In order to register my child in school, there are certain vaccines that they need to have, which arguably can be a violation of HIPAA. Why can't parents be reassured that teachers receive the COVID vaccine or not? So your child's medical record is a record that's part of the educational record of which we have access to, right? Because we're the ones that are providing that service. It is different for adults working in the school district or anywhere else. Will all schools have a tent? Yes. Dr. Icka, I urge you to consider making Wednesday a full day or consider making it a true half day, no remote work. It's very difficult to do the remote work for working parents who have multiple children, particularly in single family homes with children with special needs. The Wednesday half-day remote is a real wrench in the system. Thank you. Thank you for your thoughts and for your recommendations. I really do appreciate it. Certainly everybody hearing this will continue to take those kinds of thoughts into our decision-making processes in the future. When will the high school host a parent meeting before reopening? I believe there's one scheduled, you can definitely reach out to Principal Martinez if you haven't heard about it yet. And another reminder, please make sure K-12 accounts are up to date so you're getting all of the information as we share it with our community as well. I have 2 high school students. One wants to return and one thinks it's a death wish and does not. Thoughts? I think you're probably not alone. I definitely don't think it's a death wish. But I definitely think that there are mixed feelings all around. I would have, a good conversation with both of them, and again, maybe potentially talk to the pediatrician as well if there's a particular concern. If there are not particular health safety concerns for the family, I would be coming back to school. And I think that's important. You're going to hear me say it a lot. And we're going to keep making sure we're being as safe as we possibly can. But having the opportunity to return to school 5 days a week in person is a great opportunity. And even if it takes a little while to reacclimate, I think that's one that should be explored. What's going on with prom and senior activities? Yeah, a lot's happening, and I know Principal Martinez and his team at the high school will be happy to share. We are planning to have end-of-the-year activities for our children, and I'm looking forward to it. So there'll be more to come on that. My question is around state testing. What's the rationale for state testing when teachers had to modify a curriculum? So this is a big question related to state high-stakes standardized testing. I agree with you. I think the number one, opt-out rates are going to soar nationwide because parents are asking the very same question. Or two, the tests aren't going to count. They're going to be administered at different times of the year. They're going to be administered while children are still trying to phase back into school. In my estimation, there's a lot of big question marks there that moms and dads have related to high-stakes standardized assessments. We don't have the details from the New York State Education Department yet, but I do anticipate, like you, many moms and dads are having that conversation about whether or not they're going to participate. I would hazard to guess that there are going to be a pretty high opt-out rate nationally for high-stakes standardized assessments during a pandemic. During lunch, will kids be able to talk to teachers when they need a little extra help? I think it probably mean like going in class and meeting with teachers. That's really up to the teachers and how they set up that schedule, but I know our teachers are eager to be able to support our kids. Mrs. Torres just brought in a couple of more questions. This is going to be the last raft of questions for this afternoon, but of course we'll be back. Any word on PSATs? March 10th, 10th graders only. I know there was an update that went out last night as well from the high school, I believe, and that'll be on the calendar. If you want to check out the high school website, you'll be able to find that stuff on the calendar as well. What about gym and aquatics? Yep, all of those special areas are going to be worked out at the school level at this time right now. I don't see any major shifts in what we're doing where we have right now, but definitely physical distancing is going to be an area as more children come back to school that we're going to have to attend to. Can students take the bus home only from the high school and not be obligated to take it in the morning? Yeah, I think that's something you can give a call to transportation and talk that through with transportation. And we'll try and support you in whatever works for your family. Will the calendar remain the same? Last year, last day of school was changed since there were no state exams. We anticipate the calendar will remain the same this year, with the last day of school being where it is presently on the calendar. Thanks for that question. For the kids that are hybrid that aren't set to go full in person until the second week of reopening, will they be allowed to go to school? Yeah, everyone's going to continue to follow their schedule. So whatever your schedule is, your hybrid schedule, if you're hybrid, you keep doing that until your grade level comes in, and then you choose either full person or remote. Thanks for the question. Will the district participate in spring sports at both the middle and high school levels? We talked about that in the reopening committee today. Mr. Cameron gave an update there, and yes, I would urge you to check out the reopening committee meeting, even just to listen to it. But yes, we will be engaging in spring sports as well, and modified sports, but we will not be playing up, as it were, this yet, and we're still watching all of that. Wow, it was a lot of questions. 187 of you are still with me. I know we were up over 200. Thank you very, very much for all of your questions. I know that there's a lot in the chat, and I apologize that I can't get through the chat. When there are a lot of statements in there, it's hard for me to find the questions. So we did our best. Liza pulled them out. Thanks so much, Liza, for doing that. And if I didn't hit a question that's burning, please feel free to reach out to us at any time. Again, this is an exciting time for us. It is a very special time, and for all of you who are taking all this in and processing and thinking about this, I know it's a lot to think about. We're going to be here with you every step of the way, as we have been. And so just know that if you think of something tomorrow, if you think of something the next day, you can always reach out. Reach out to your child's teacher or principal, reach out to us here. We'll do additional updates moving forward, and as I mentioned, you'll get that schedule coming out tomorrow or Friday, And I hope that you're having a great day. I hope that we answered all of your questions, but I hope that you feel like you have a lot of information now, maybe that you didn't have 48 hours ago. Thank you so much, everybody. Thanks for your continued support and your flexibility. Stay safe, stay strong, and stay WP proud. We will see you next time. Have a great day.